Thank you for that. Doing some quick lightning round updates. So often these lightning rounds will be very focused on the goal that we're talking about, but we're also realizing there are some timely updates that could fit in lightning rounds that might be not specific to the goal we're on per se. They might be broader. So we'll have that quick lightning round update time, and then we're going to spend time hearing about the Help Me Grow initiative in our state, which is just so relevant to the early identification goal. And we'll have time to engage around that topic, have Q&A, and some breakout discussion. So that's the main focus for today. So I think we can move right to the lightning rounds then, if everyone is able to. I had an experience at my last meeting where I couldn't type into the chat for some reason. So hopefully everyone's able to access the chat and type into the chat and scroll through and see who all's with you. Oh, thanks for that. Yeah, we can just turn to video now. I don't have slides to show you. So anyone who wants to turn on their video, please feel free, and we can feel like we're here in a room together. So I'm going to kick us off with the lightning rounds and just give a little bit of an update on the Act Early COVID-19 grant, the initiative, and what's been happening with that. So hopefully everyone remembers that we had that separate Act Early COVID-19 funding. Chris Barnico isn't able to be here today to give the update directly as the Act Early ambassador, so I will do my best to do that. And we're sorry that she couldn't be here with us for this particular meeting. But if you remember, we probably last talked about this when we were doing the needs assessment. So the Act Early COVID-19 initiative pulled together several people from this team, people from Birth to 3, the maternal and child health programs, children with special health care needs program at DHS, the home visiting program, Diane representing the AAP and pediatricians, probably missing people, but just a number of folks. And we did a needs assessment related to how are things going in terms of early identification of kiddos, and how is COVID-19 impacting that? And when we were thinking about early identification, we were really looking at those steps of developmental monitoring, developmental and autism screening, and then referral and getting into early intervention. As part of the needs assessment, the formal needs assessment process given to us by the CDC was really focused on leadership, getting answers from leadership in these organizations. And so part of our needs assessment actually identified the need to hear from families and to understand what they were experiencing. We're particularly interested in the families that are socially and economically marginalized in some way, and most falling through the cracks. So one of the new developments is we have a couple of family leaders in Milwaukee, a Latina mom and a Black mom, who have been LEND trainees with us, who are leading a listening session this month, and perhaps more than one, depending on how many families are interested in sharing. And we'll be able to really get some input from families about the nature of the experiences they've been having, and we'll be feeding that back to our partners. Another thing that's happened in this initiative is that we've updated the Act Early Wisconsin website, the website for families and providers in the community. We've translated that into Spanish as well. Finally, we've reinvigorated our Facebook presence and really trying to make sure we're creating opportunities for families to engage with the Learn the Signs Act Early resources and learn about that. Chris has also supported outreach in Milwaukee and the transit system, putting up advertisements that let people know about these materials and the milestone tracking app, and an ad on or sponsorship on the Wisconsin Public Radio, so NPR, WPR. So it's been kind of fun to hear. You might have heard some of these things out there or seen these things out there. So please, in your organization or agency, if you have Facebook for your program, connect to the Act Early Wisconsin resources, and we'll just keep trying to use that as one tool for getting the word out. We have ordered a lot of children's books materials. Some of them are focused on resiliency, supporting resiliency, and some are from the CDC, and we've been distributing those through Birth to 3 programs, Reach Out and Read programs at the pediatrician's offices, and the home visiting program. So Chris could tell you much more about the wraparound or the supports that have been put in place so that there's a bit of engagement with the families as the books are shared through these programs. But kudos to Chris, to all her work to support the providers in that effort. And I think that's, there's more going on, but those are some of the highlights I wanted to share with you, so you'd have some sense of what's evolving in that effort. And then I wanted to kick it over to Lindsay, who had some updates on us for us about things that are happening in the state and with the budget that might be relevant.
Sure. So this is not my area of expertise. There might be people who know more, but I will share what I know. So the Wisconsin Autism Providers Association, or WAPA, has really been working hard to advocate for a rate increase for behavioral treatment for autism in the biennial budget. And so they had initially requested a 25% increase across all behavioral treatment codes to help with access and equity for services, and to help with recruitment and retention of behavioral treatment providers. And there's a lot of back and forth, a lot of support, a lot of advocacy, but ultimately what is in the governor's budget that's been approved is a 15% increase for the most commonly used direct treatment code. So that intervention provided by a technician. And so that will again help really with recruitment and retention of those treatment providers, but also with equity and access to services. So I think if people have questions or want more information, Becky Thompson is the president of WAPA. But additionally, in terms of things we can do is reach out to our representatives and really send a note of thanks for supporting that legislation to hopefully increase access to services through Medicaid. So I can try to answer questions, but if I don't know the answer, then I can definitely gather questions and pass them along.
Anyone have questions about the two updates we've given thus far? We look forward, we will continue to have these Act Early state team meetings and have these lightning rounds. And as you have ideas of things that you think others in the team should know about, might want to know about, that could fit this kind of an update, please let Nicole know, and we can include that in future meetings. But we also have a couple of minutes right now if there was something that anybody wanted to just let others know about on the team. Please unmute yourself and let us know.
This is Molly. Can I go ahead and share?
Please.
Okay, great. So the Board for People with Developmental Disabilities, like the Weizmann Center, got some extra funds for COVID. And so one of the things we're doing is a vaccine helpline. So I'll just put that in the chat. So if you know of any people, families, whoever that would like help scheduling a vaccine appointment, that's a resource people could be accessing.
Thanks, Molly. Super. Great. So glad we had a moment to open the floor there. If there aren't any others, I think we can go straight to the Help Me Grow topic. I'm really looking forward to hearing more about this, Barb.
So are you wanting me to go ahead?
Yes, I think you can go ahead.
All right. Let me share my screen and get started. Hello, everybody. I am Barb Tingestal. I'm up in the I live in Appleton, in the Fox Valley area, and wanted to share with you a little bit about what is Help Me Grow. It's a national model, and then we've brought in Cassie, who's going to share with you about the national model itself, its evidence, fidelity, and then I'll come back and share with you about local implementation, like how are we making that happen. And I just have to say it has been a really exciting past few months of really great data and stuff that's going on, and so looking forward to sharing that with you. I wanted just to share with you that First Five Fox Valley we work with our Help Me Grow model is in Outagamie, Calumet, and Winnebago counties. And there's some conversation about possible expansion to Shawano County and other areas that are connected. And we are presenting a community partnership model, building on the resources already and the agencies in our area. And then we are expanding developmental screening and assessments for infants and toddlers. In the process, we have local support, and I'll talk more about that, about how our community has really come together to fund this piece. So just setting the stage about Help Me Grow, I'm going to pass it off to Cassie. And Cassie, if you just want to, you can either say next slide or lift your finger, whatever you want to do, and I can do that. So as a brief introduction, First Five Fox Valley is the state affiliate to the National Center for Help Me Grow, and they provide amazing technical assistance and support. And so we asked Cassie to come and share about the national model, and so she has graciously offered to give you a really good overview about that. So Cassie, take it away.
Thank you. And thanks everyone for having me today. I'm excited to be with you. My formal title is the System Building and Implementation Specialist at the National Center. There are a couple of program specialists. We offer technical assistance to the state affiliates across the country, and offer a lot of professional development and oversight to like best practices and things like that. So I'm excited to share a little bit about Help Me Grow. I'm not sure how many of you are familiar with the model on a national level, but we were started in 2005, and we can go to next slide. We were started in Hartford, Connecticut in 2005, and since then have been replicated over 100 times across the country in 29 states. And the model itself is really made up of these 4 core components here. So the system, the Help Me Grow system model, our catchphrase, our vision, our mission is that we believe that all children should be able to grow, develop, and thrive and reach their full potential. The model works to promote collaboration across child-serving sectors in order to build a more efficient and effective system in promoting an optimal, healthy child development for all children. When all of the organizations in the early childhood system are working together on behalf of children and families, we can better prevent and reduce the impact of stress or adversity that children and families are facing, and increase protective factors that maximize the well-being of children. So our 4 core components, you can see here, the gears are working, they're interconnected in family community outreach, child health provider outreach, the centralized access point, which is like a call center or the point in which care coordinators are connecting with families, and the data and collection piece. Next slide. Our value proposition, the Help Me Grow model advances racial equity through targeted universalism. And what that means is while Help Me Grow is available to all families universally in a community, we're also documenting the gaps in the grid, the power grid of the Help Me Grow early childhood system, and supporting the barriers and for families to access the existing resources. We leverage that data to develop strategies to aim to reduce those barriers. The network itself is one in which, and Barb knows this, you can connect with other states and how they're troubleshooting these barriers. You can find best practices on engaging a sector or a partner that you haven't yet connected with. We have a standardized data collection system. And we use that data, like I said before, to target strategies to overcome and fill the gaps that families are facing. Next slide. Help Me Grow. We worked with the Frameworks Institute to get a handle on messaging that would work for all of our states around the country, and for the purpose of describing what Help Me Grow is. And the best visualization that I could give you is that it is like a power grid in which different sources and different resources, community partners, different stakeholders are plugging in to the Help Me Grow system in order to have families to have access to the resources they need. So when a solution, a resource, a stakeholder plugs into Help Me Grow, that's one more connection that can be made for families through the Help Me Grow model. Help Me Grow strengthens this resource by maintaining a resource directory of all available services and resources within a community, and connecting providers to each other to create an interconnected early childhood system. Families benefit as Help Me Grow listens to them, connects with them to services, and provides ongoing support to all of those who are in the power grid. Next slide. Here's a map of where our Help Me Grows are. Like I said, there's over 100 right now. There's about 114 to be exact in 29 states, 28 plus Washington, D.C. This started as one single system in Hartford, Connecticut that went statewide and then replicated first in Orange County, California. Since then, we have added all of the states that you see here. Next slide. This is a little bit more about the 4 core components. So these were the 4 gears shared on one of the first slides here. The centralized access point, the family community outreach, child health provider outreach, and data collection and analysis. We have a national fidelity assessment that each of our Help Me Grow systems take once annually to assess how they're implementing the model and in which phase of model implementation they're in. And we use evidence-based implementation science, as well as a work group of affiliates to develop the assessment itself. It's administered, as I said, once a year, a series of questions and impact indicators where Help Me Grow affiliates report unique interactions, meaning how many individual families served, how many events and networking meetings they're having with partners, their relationship with child health providers across their either state or county, and a variety of other data points like barriers, challenges they're facing, CQI projects they're working on, etc. So each of the systems are assessed amongst these 4 core components and the 4 key activities that are related to each of them. So you can see whether or not a system has a specialized child help development line, which is the call number or the website in the case of Wisconsin, where people can connect with Help Me Grow, what their linkage and follow-up rates look like, the process they have for resources and researching resources, maintaining a directory for families to access, as well as for care coordinators to access or outreach coordinators to access to identify services that are available for families. We assess their engagement with community partners, the way in which they network, the trainings and events that they offer to families and community partners, their marketing efforts. When it relates to child health provider outreach, we assess their relationship with their physician champions across the state or county that are also promoting Help Me Grow or linking families from their practices back to Help Me Grow for support. Help Me Grows offer training on surveillance and screening. They offer training on referral and linkage to providers. And we assess how successfully they're closing that feedback loop between families, providers, and Help Me Grow. And lastly, we do monitor the way in which they're capturing their data, the way in which they're sharing data across partnerships, their CQI projects, and the way in which they're assessing the data they have to make continuous community changes to support the community. Next slide. So just some of our, right here, just some of our most notable data coming out of our recent assessment, which was last fall. And so we have another iteration this coming fall. This is an N of 100. So that at the time of the assessment, 100 Help Me Grows were able to take it. And so we had 9 of our Help Me Grow systems, and these could be county level or state level, depending how they've established themselves. 9 were in exploration, which means that they are just building up their system right now. They're identifying partners. 78 were in installation, meaning they are in the building process, but they're a little bit more advanced. They're working towards having almost all of their core components in place in all of their key activities. And 13 were in full implementation, meaning that they are currently deploying the entire model to their community or state. All 4 core components are active and in the community is engaged with them. Next slide. Just some notable data here. Over the course of 2020, 102,000 unique interactions across the country. So unique interactions is interactions with families through the centralized access point, the call center. 81% of families across the country reported that their needs were met when accessing Help Me Grow. 16 new systems joined our network in the year. 10 advanced to overall implementation status, and 20 were just 1 or 2 key activities away from being in full implementation. And that's why our number in installation is so large, because we have so many Help Me Grows that just need 1 or 2 more aspects of the model to be fully implementing it in their state or county. Next slide. Knowing that this meeting and those who are present have a special interest in screening and in particular autism, I heard is the topic of this meeting this week or this month. I don't know how often you meet, but I did want to pull the data for you on the screening tools that are used across the Help Me Grow network. And as a reminder, the end of this is 100 systems. So 74% are using ASQ3, ASQ, SE2. MChat is very popular amongst our network, PEDS, SWIC, and social determinants of health. And then these are some of the others that are mentioned as well. So Bracken, Dial, Spot Screener, Lift the Lip, Cafes, which is also another social determinants of health. So just wanted to share that with you all as well. Next slide. And then I also just mentioned that the National Center and the Help Me Grow National Network, which Wisconsin is included in, is going through a strategic growth plan and progression right now. So this is year 1 of 5, in which we'll be working towards these 5 growth priorities, including advancing our impact model and measuring our network performance towards equitable outcomes, accelerating our ability to use data for community change, clearly defining the model and how it should be used for racial equity, securing robust funding for our early childhood system infrastructure, and pursuing 3 times growth. So of our number of 102,000 interactions in 2020, we're looking to have our annual interactions be closer to 1 million in the next 5 years. So that's just a very high level overview. And I know Barb's going to take you through exactly how Help Me Grow looks in Wisconsin and how each of those core components are being implemented.
So I want to set the stage by saying First 5 Fox Valley is our work is not just Help Me Grow. it's a component of it. It's an initiative, but we have many other partners and projects that we're intricately involved with. We work with Family Services and their Welcome Baby project and hospital assessments. We have our Early Childhood Resource Directory I'll be showing you. We have an expansion project of developmental screenings that's funded by the Community Foundation in Oshkosh. And we work with ASQ screenings. We do a data project. We have lots of parent support with referrals, and I'm excited to share with you because that's where Help Me Grow is really linking us lately. We also won one of the preschool development community innovation grants to kind of pilot Help Me Grow in a broader way. We work with our local Chamber of Commerce. We do employee-friendly workplaces, what that looks like for families. And then we do some advocacy work. We're a part of a regional child care alliance. So just wanted to set the stage. Help Me Grow isn't the only thing we do. It's a big component that a lot of these are woven into. So you heard Cassie talk about the 4 gears. So I wanted to share with you what that looks like in the Fox Valley. First of all, our Help Me Grow Fox Valley is funded by local grants. We have community foundation grants in the Fox Valley, community foundation grants with Oshkosh. We have Theta Care, one of our health providers provides chat money for us. Our services that are even starting our Help Me Grow was done by funding with the Rotary Club. So we really have a model that's been, I would say, organically grown from the community. We also, you did hear that we are the Help Me Grow Wisconsin affiliate. So if we look at scaling statewide, it would funnel through what we're doing as the state affiliate for Wisconsin. We utilize, you heard Cassie talk about the centralized access point, and I'll get into more detail about that. But we, for our database to access and utilize all the data, we contract with Help Me Grow Utah, and we utilize their database. They have provided technical assistance. They tweaked it. It's a Wisconsin-focused database now. And you all know if you've had to build your own databases, they're expensive. So we've learned from the best, and we've taken the Help Me Grow Utah database and made it our own. We've identified the screening tools that we're using and promoting as the ASQ developmental screening tools, the ASC, the ASQ 3 and SE, and then we're looking at adding an MChat also. First Five Fox Valley does have a Brooks Enterprise system, which has been really key. It's funded through some of our community grants that we have, which allows then for childcare programs and school districts and others to actually do online family access to the Brooks system free of charge for them, because we have grant funding to support all that. And then we have a searchable early childhood resource directory. So a part of our gears locally is our centralized access point. The orange gear is built in with our website, with our Help Me Grow database that we utilize, and a call-in line and pieces like that. Our family and community outreach is our navigator system that I'll talk more about, where we have a navigator at early intervention and one with family services and one working with childcare providers. Our data collection has 2 venues or avenues. One comes through our Help Me Grow database, and I'll show you what kind of data we're able to collect through that, and also through our ASQ Enterprise system. And I'll show you what kind of screening and data information we pull from that. And the point for that is we want to make sure we're targeting our local community resources towards where it needs to be, because our community is the one that have organically supported this. So they want to know, where do we need to continue to put our local dollars? And then last is the childcare health provider. This is where we need some help. And I know the ACT Early leadership team is now helping us look at this more. We do have a couple of champions, but we haven't really activated this part. This is really a good growth area for us that we're working on. So how does it look? How is this system happening in the Fox Valley area? So it starts within the middle. First Five Fox Valley hosts the centralized access point. And that is, like I'll share with you in a little bit, the database and the website and the free screenings and the ASQ enterprise system. And when we first started, when we were first like in that phase of trying to implement, we had a navigator placed right here in the centralized access point. And we found out after 3 months that did not work. So we remodeled it and built it out at the end of January, where now we have MOUs in place and we contract with partners. So our early intervention birth to 3, we pay them 20 hours a week through grant funds. We give it to early intervention and they have a Help Me Grow navigator right at birth to 3. We wanted to go where families were. We realized nobody was going to call us and find us. We needed to go where they were. So as an example of how that works, when a referral is made to birth to 3, if they don't qualify for services, we found that all of those families, that was it, right? Well, now they get to be transferred in to Help Me Grow, and we give them welcome letters and we send them a follow-up screening if they want to take that in 6 months. We provide support as they're looking for resources. So we found a way that all the families that don't qualify for home visiting or early intervention still can have some support within their community in what ways they might need. So we have a 20-hour-a-week navigator in early intervention. We have a 20-hour-a-week navigator at family services. And this is our navigator there with all the prime births and the new parent hospital visits. They have the opportunity with our MOUs to sign up to be also a part of Help Me Grow. So if they don't qualify for home visiting, they now can actually be moved into Help Me Grow and get support that way. So it also is across all income levels too. I wanted to say that because our community realized not everybody is low income where a lot of resources are targeted, but really could be have many needs that aren't necessarily based on some of the services that they were able to access. We also received a preschool development grant. And so we have an outreach navigator who is out of First Five, but that person is touching childcare providers, school districts. We have 4 school districts now that are all doing ASQ in our enterprise system. And those families are able to flow into our Help Me Grow database. We have 11 new childcare programs that are now using the ASQ and getting support. And I have some really good success stories to tell you about that. So basically, we are now able with grant funds to give 20 hours a week to our partnering agencies to have Help Me Grow navigators in their own spots. And it frees up that 20 hours for like early intervention and family services to do other types of work with that money. And our navigators in all these areas meet weekly. We monitor, discuss referrals, look at the Help Me Grow system, and then also we realize what kind of community data needs to be shared out. So local implementation has really these 5 components. One side, we have a website for easy access for parents to ask questions, tap in with chats, email us, things like that. We have our Help Me Grow database for referrals, follow-up, and data. We have the ASQ enterprise system. We have an early childhood resource director, and then we do a community data project. So to take those components, there's a lot on the website, but this is what it looks like. There's the address if you want to Google it while you're looking. But what's available for families on the website is access to free screenings. They have the ASQ SE, the ASQ 3 in English and in Spanish. And it's all free, and it flows into our Help Me Grow Fox Valley enterprise system. ASQ enterprise system. We have a call-in center that they can ask questions about parenting, or if they have a question about where's there a resource. We have FAQs under the parents, the For Parents tab, about what kind of questions they might have about what is my child developing normally, and then they can click on the state website, or they can go to the CDC's Milestone website. And then we also have referral forms for healthcare providers that they can actually just have parents sign. They can download the form, they can have parents sign it, and they send it over to us. And we're able then to share data back and forth with our healthcare provider community or too. So what is the Help Me Grow database? It is a family database. So you can have a family, and we have information on that family, and then they have children that are folded underneath of it. So if a child has an ASQ screening, that over an API bridge comes into Help Me Grow. So we can keep track of all those individual children under a family and see how those kids are doing. We can also provide family support. And so that's called family follow-up. And under family follow-up, we can set to follow up with them in 2 weeks. We can identify what resources they've gotten. We can also pull lots of information. So this is just some of the data that we can pull. You know, what was their point of entry? Did they come over through early intervention? Did they come over through a childcare provider? What kind of call was their reasons? You know, what are some of the agencies and reasons for calling? And then you can't see it so much here, but what kind of follow-up tasks did we do for them? So we can do lots of information. We also, with Help Me Grow, our database transfers through an API ASQ screenings. And so as we have developed a robust use of our ASQ enterprise system, every week on Mondays, I do an API transfer, and all of those children's screenings get folded into their family follow-up. So we're able then, this is just an example of some of the data to be able to pull. When I pulled this, I don't remember, this is a screenshot I've had for a while. You can see at this point, we had 237 ASQs. We had so many of them had no concerns. Some had monitoring, some had some concerns. It shows you the ASQSE. I can even count the exact number at what months those ASQs were taken. So here's 33, the 33-month ASQ. We had 28 of them, which is about 11% of all our ASQs. But I think what's really interesting for everybody to realize is it also, for community data, we're able to actually see what's the number of concerns or monitoring that is happening of all of those ASQs that are coming over. And this has been really helpful for targeting our resources. So as an example, I'm going to show you in a little bit, we're finding that fine motor skills are coming up with many more concerns and monitoring since COVID. And some of that is one person said, you know, these parents weren't pulling out the Play-Doh with their kids and weren't utilizing, you know, scissors and other fine motor skills. And we really saw a change in that. And we're seeing that coming through. So just just to let you know where we are, we just implemented our Help Me Grow database in February. We already have 385 families in our database, and we've done, over the past year, 1,458 ASQ developmental screenings. So the other part of that piece for us is we have an ASQ enterprise account. You can see it's the First 5 Fox Valley. We are the account holder. We can have a number of programs that are in here. And this is just data that we can pull from the ASQ enterprise system. Each of these programs has their own access to it, but they can't see everybody's data. only I, as the account administrator, can go through and pull, these total amounts. And so just to share with you that it showed that within this month, from August last year to mid-July this year, we've done 1,458 screenings. You can see July was a high month. And then I'm going to flip over and share with you, I hope this, can you see the aggregated results? Somebody? Hopefully, okay, I'm talking about it even if you can't. So we were able to pull from our development screening project pre-COVID and COVID aggregated ASQ results. So as an example, I'm showing you the ones during COVID. I can go by month and look at where they are below cutoff levels, where they are monitoring. And so when we went through and compared pre-COVID from June 2019 through March 2020 versus this screen, you can see I was able to pull from March 2020 to June. We found huge delays in fine motor skills and also in communication skills. And it was really interesting. We found it primarily from 24 to 36 months. So an example, one of our partners, the Building for Kids, it's a children's museum, was able to take that data and is writing in a grant to talk about how to expand manipulative areas in the children's museum. That shares with you the kind of community data that can help our partners and be targeted. So we have developmental screenings. Another component of our Help Me Grow system is, and you heard Cassie talk about, is these resource directories. So we have navigators. We need to be able to tell them and help families find resources. So we were able, with a U.S. venture grant, to build out, this is a Salesforce platform, a resource directory. And we have 9 different categories, 126 different searchable topics. And these are all agencies within the 3-county area of Outagamie, Calumet, and Winnebago. And this is just a screenshot of the partners. It just shows you like all the partners, everybody from the Appleton Area School District. We can look up and find out their information, Appleton Public Library. Here's the Bridges Child Enrichment Center. We can search by partner, we can search by category, we can search by topic, all different types of things, and find a resource to support a family. And I guess I want to share with you, just as kind of an ending, is what we have seen as really a positive approach to what we're doing is it was community driven. So our database was supported by the Rotary Clubs. They gave us $8,000 to have Help Me Grow Utah build it into Wisconsin's model. They helped us pay for our enterprise system. And then we have another grant that's helping pay for all the screenings that we have, the online screenings, those 1,400 screenings. If you have families do online screenings, it costs 50 cents. If you just end up putting the paper copies in and putting them in yourself, then there's not a charge for that. But we were able then to actually help all of these programs. Like Oshkosh Area School District now uses our enterprise system with all the data of 4K students coming in who take an ASQ screening, and it's not costing Oshkosh Area School District anything because collaboratively we've come together to support the screening piece. And I guess I just want to share one success story before I leave. So last week, we had a call from a healthcare provider, a pediatrician's office that had heard about Help Me Grow. She sent over a referral form. She downloaded it from the website. She sent it over. We assigned it to our family services navigator, since she does all the hospital assessments, which we need a healthcare provider with. And Sarah called that parent. And that parent had a 6-year-old child and a 7-year-old child and a 3-year-old child or 4-year-old child. And it was this was their grandmother who was suddenly a foster parent to her two grandchildren, her two grandsons. She moved from Milwaukee because Milwaukee was a part of the issue, a bad influence on her kid, on these grandsons. She moved to Oshkosh and she didn't know what to do. She got her kids in to get screened. They needed some health checks. The healthcare provider said, you need some support. They called Help Me Grow. We were able to call that family, that foster grandma, and get her some respite care, get her kids signed, get her one child signed in, an ASQ screening and an ASQSE, and giving them the support to get into Oshkosh Area School District. And it's just that grandma said, that foster grandma said, I did not know how I was going to do this. I just moved to the area. I didn't know what to do. And thank you so much for being here. So just kind of a success story of how the system kind of works together and we're able to pull our data. And just as a support to show you all of the partners that have come together to make this all work. And I guess that's it for us. And we will answer any questions you have about the national model or local implementation.
Thank you, Barb.
Hi, this is Diane Gerlach. I'm in some of the early childhood programs, and we do a lot of ASQ down in southeastern Wisconsin. And we've tried working with the daycare centers, training them on ASQs, and we do have the enterprise system through our health department. But we've had a hard time keeping the daycare centers engaged because we've had a number of them learn it, but then it falls off and they don't do it anymore. So how did you keep them engaged?
So with our regional development grant, we were able to add in a navigator called Outreach. And so Dr. Susan Finkel, she's retired from the University of Wisconsin Oshkosh system, wanted part-time work, right? And she's been working the area forever. And so we hired her, we contracted with her for 20 hours a week. She took all of the childcare programs. We started with those that were at 3 stars in the quality rating system because they didn't have a child assessment piece. And that's how they weren't able to move up to 4 stars. So she connected with those directors and said, we can give you the free family access. So she started, we give them free, the ASQ boxes, we set them up, and then she follows up, and those families, those childcare programs have had families do the ASQ online. Then we're able to look and say, oh, one program, childcare program, ended up with 5 fine motor concerns. And so then Susan goes back to that program, to that director, and says, look, you have kids that you have 5 of these. How do you want to go about working that? And so it's been having outreach that the childcare directors can actually have somebody support them in knowing how to read it, and then supporting those families. So those families enter in to Help Me Grow so that our navigators can follow up with them. So the point of contact with families is at the childcare program. But then because they then flow into Help Me Grow, we have navigators. If there's concerns, we send letters to say, hey, here's your ASQ screening. We see concerns. Here's some follow-up activities. And then we'll follow up with you in 6 months to see how it's going. And then we connect with the childcare program also. But I would say the key part is having somebody that's their job to nurture those directors. Because once you get the directors connected, they'll keep it moving. And if they don't feel like it's one more thing on their job, if they feel like, hey, we can give the parents this online access, it flows to First Five's enterprise system. When we see there's concerns, we're the ones that are calling the childcare provider saying, look, this is like, you have these 5 kids, what can we do to support you? That helps them, they appreciate that kind of support.
Barb, one of the things that we found when we were working with childcare programs was that with early Head Start and childcare programs is that there was a little bit more of a tendency to support the kids in house instead of instead of supporting them in house and also referring for, say, an evaluation or whatnot. And I'm wondering, I hear that kind of support in what you're saying, and that works really well for the directors. I'm wondering how referral to healthcare, to evaluation by a psychologist or whatnot, where that might fit in with what you guys are doing.
So there's a few ways you enter into the system. One is either through your child care provider, or we do have Head Start that's starting. And so when these families take the ASQ and they're looking at those things, then you have to have the follow-up. And that's the beauty of Help Me Grow. So when we see that there's concerns in their monitoring or their screenings, then we have somebody that connects with them that says, where do you go from there? And then we search if there shows that there is developmental concerns or monitoring, then we'll say, where do you live? What childcare program do you go to? And then we'll say, you need to go to your pediatrician, or you need to go, we'll help them find those resources. Or we've even sent them to the school districts, to the Child Find or Birth to 3. But that's kind of the beauty of having the navigators in those agencies, because the services will stay within the agency. And if they do find that they can't serve them, that's when we'll refer back to health providers or other places. I don't know if that answers your question. But the other part of that, I should say, is those navigators can also see, remember, it's a family. So even though a family entered in, say, through Head Start, that family in Help Me Grow, we can see that they've gotten services, say, through their healthcare provider. All of that's recorded in the Help Me Grow database, what all the follow-up was happening to support that. So every navigator can see how that family interacted with the early childhood system, even to see what childcare program they're in.
That's great. Thank you.
Mm-hmm.
Other questions?
Hi, Barb. This is Leah Ludlam. I was just curious, what is the cost of the Help Me Grow state affiliate membership?
Leah, you were cutting up for me a little bit. Either can you say it again, or can somebody else repeat what she was saying?
What is the cost of the Help Me Grow affiliate for you in Wisconsin?
Yeah, so we, to be honest, we pay $3,500 a year to be a part of the National Center with the technical assistance. We pay $6,000 a year now. Our startup was more to build out the Help Me Grow Utah database for Wisconsin. So to start up the buildup of that system was about $14,000, but now that the database is already built, we pay $6,000 a year to have access to the Help Me Grow Utah Wisconsin database. And then our enterprise system, we pay for ASQ, we pay about $1,200 a year, and that includes the family access and the enterprise. And we can add as many programs under that as we want. So that's kind of our bottom line costs for everything.
Thank you.
Yeah.
Are there any costs, Barb, for other programs or partners who want to work with you in the Help Me Grow program?
So no, at this point, because we're community funded, so we've been able to pay, like you saw, for 20 hours a week. I have a contract with Early Intervention for, I think, $32,000 this year for them to be able to have the Help Me Grow database access and their navigator to be a part of our team. So we're freeing that up for them. They don't have to pay us to be a part of that. but we're not opening it up to everybody. At this point, we're trying to just make sure we're being holding the fidelity of the system, but we do have some ideas of how to expand statewide and scale it. But, we're just starting those conversations.
This is Anna Harris. I'm at the Wasteman Center with the Actorly team, a group that belongs here at the Wasteman Center. When I first heard of a model like this, which I think is the one that started in Orange County, California, so this is my kind of a high level question, but I think one of the real issues in making this a successful model was the recipient end of the referrals. So really knowing that there was a group, if you made a referral, there was somebody who could follow up, provide services, do diagnosis, et cetera. And I know this in our Act Early plan, identification and family support are sort of like the first steps. And then the third one that we're going to talk about at our next meeting is sort of who's doing diagnosis and treatment and what's the capacity to handle that. So I'm just wondering, sort of at the national level, like how is that being tracked? And I know you have a feedback loop. And then also sort of at the Wisconsin level, like what are you doing, if anything, or needing to increase the capacity of providers in your community to respond to potentially an increase in referrals and need for services?
That's a really great question. On a national level, we do track referrals, whether or not someone is calling a Help Me Grow for just information, whether or not they're calling and a referral is needed and they either accept or decline follow-up. And so our Help Me Grows are working with the providers within the community to assess who has the capacity. That's all built into a great resource directory, is whether or not the people in it actually can accept patients or children at the time. And then you're right that we do track feedback loop. And so our Help Me Grows are expected to follow up with families to ensure that all families' needs were met and that there aren't additional services that they now need to be connected to. On a national level, that is built into our fidelity assessment. So we have an aggregate data on all of our systems as a whole, and then each of our states has their own feedback loop percentage as well. And we work with them through professional development, like universal trainings. We have resource guides on how to strengthen those partnerships and ensure that families are following up. Providers are following up with families, and that Help Me Grow is following up with families. And then actually Barb and I most were recently talking about how other affiliates are doing it. So one of the real benefits of our network is that we have 114 examples of how Help Me Grows are doing that currently. And so that does look different depending on the type of system that they have, the care coordination protocols that they have. But a lot of them are following up not only immediately after, within like a week, but they're also following up a month after services to ensure that there are no additional needs that need to be met by the family. And Barb, you could probably speak more to how you all are ensuring that families are connected on a Wisconsin level.
Yeah, and so in the database itself, every family that we enter in, we have a contact. You heard Cassie talk about the number of connections that were made with families. In the database itself, we have an automatic follow-up. So it will talk to us, but we set a date for that every new family that comes in, we follow up within that week, 2 weeks, depending what it is, and then every 6 months. So have we reached capacity? We don't know that yet because we're so new. So we did start with Help Me Grow Navigator at birth to 3. And then in May, we added in family services. We had started with our preschool development grant person. So right now we have 3 at 20 hours each that are really just doing just amazing work. and they aren't at capacity yet, but there's a way of monitoring that in our database, like who has how many clients, if you want to say, or families. We haven't reached that yet, but I don't know. I hope we do. I hope we have to grow, right? That means you're really helping families. And the other part is we track success stories. That's in the database also, like what do parents have to say? And then a parent satisfaction survey is being developed so that that goes out to families right away. I don't know if that's answering your question.
Yeah, thank you. That was helpful. And I think I'm still thinking further down the road, in terms of community capacity to identify, to diagnose and provide services. But yes, I think if you haven't reached capacity within your family connection or navigator, then, maybe it will grow over time. It just, we hear a lot that there's not enough services for the kids that are identified. So that's where my concern was coming from.
Yeah, and we do have that come in through our annual assessment as well. We have a series of questions around barriers that families are facing and reporting to Help Me Grow. And I would say a year after year, that is one of them, that the wait times for services are very long. And so Help Me Grows are looking for alternatives that can meet families' most immediate need and support them while they are waiting for that physician that has an opening to see a child or whatnot. So there are some affiliates who are really diving deep into what can be done to, and this is a terrible reference, but to hold over or that wait time until a family can actually be seen, because they do recognize that the children need support immediately.
And that sounds like because we're talking about this in the context of the Act Early state team, which has a state plan that covers all of these steps in the process. As Anne was bringing up, we have a unique opportunity, I think, to be collaborating with, partnering with the partners in the system who do that training, the capacity building, or can help in that area. I think I am curious about at a national level. I know that some of the Help Me Grow states are very tightly knit between the Help Me Grow and the Act Early ambassador, the Act Early, the Learn the Science Act Early. I know Minnesota and Vermont. I'm wondering how common that is. And then I'm wondering about, I know that some of the affiliates do autism screening as a routine part of what they're doing. So the recommended screenings now in the pediatrics journal article are there are three. So it's the general developmental screening, the autism screening, and then the behavioral, Lindsay can tell me the right wording, but the emotional behavioral screening. So I'm wondering about how well it covers all of those, or in which states cover. Let me rephrase my question. Which states tightly knit Help Me Grow with Act Early, and which states are incorporating all of those forms of screening, particularly autism?
Yes, so we have several Help Me Grows that are very tightly coordinating with the Learn the Science Act Early ambassadors in the state. So yes, you named Vermont for sure, Florida, Indiana, and they're actually the co-host of our national conference this year, in which the Learn the Science Act Early ambassador from Indiana will be presenting. So happy to share that, or you're all welcome to attend as well. Then Barb, you can share that information more broadly if you'd like. So there's quite a few states who are working really closely with the Learn the Science Act Early team. In addition to that, the National Center last year hosted a community of practice on the integration of Help Me Grow, WIC, and the CDC apps that are available for families. And so we have a lot of resources coming out in the next 2 months or so on a culminating report of what all of the Help Me Grows are currently doing in that area that participated in the community of practice. And then I will say, as far as screening, there isn't a screener that the National Center says like you must use this screener. It is up to the Help Me Grows to determine that. One, because a lot of times there's a cost associated. For example, Barb shared about the ASQ Enterprise, so we don't prescribe to every affiliate like you must get the ASQ Enterprise, you must do ASQ SE. Two, we don't do any of that, but we do assess who is utilizing almost every Help Me Grow if they have an active CAP. So I should say every Help Me Grow that is actively taking calls from families or actively serving families out in the community is using ASQ and ASQ SE. There are Help Me Grows that are not reflected in our data that have not established their centralized access point yet. They're still securing funding or they're still securing care coordinators to do that actual outreach work or connection with families. So we don't have their data. I can't speak exactly to like the most popular autism screener that's being used, but I could pull that data and share with Barb, and then she could share back with you all.
Great, thank you.
Welcome.
Lynn, do you want to transition us to the next step?
Sure. Thank you so much for the great presentation and the lightning rounds beforehand. So like always in the Act Early State team, we like to have an opportunity to dialogue with each other so that we can, network and collaborate. And so we are breaking into, I think, just 2 groups. And so we will put these questions in the chat when you get into the breakout room, but I'm going to read them out loud quickly. So what opportunities for collaboration exist between Act Early State team members and First 5 Fox Valley Help Me Grow initiative? What more would you like to learn about the Help Me Grow initiative? And what are next steps for aligning or collaborating on work we're already doing to advance the shared goals? And if appropriate, who will take the lead? So we will be breaking out and discussing and coming back at 1:25. So we'll have about 13 minutes. All right, we'll see you in the breakout room.
I know we had a really good discussion. I hope you guys did as well. And I think we're always doing a little bit of behind the scenes touching base. I think our team was thinking that we don't have time in this short Act Early State team meeting format to do really a lot of report out here, but were any just popcorn ideas or things that really stood out to you that you wanted to express to the whole group before we wrap up? We've taken notes, and as you've probably seen, I hope you've seen, we have been working on these strategies that will allow us to work together well when we're not in this big meeting. And that has included more resources on the Act Early State team website that'll continue to get built out, and a newsletter for the team members. I hope everyone has seen that come through. So you can expect follow-up. And at any point as you hear that feedback, or as you see that communication, whenever you have ideas or thoughts, insights into what could better support you being informed and feeling like you're in the loop, feeling like you have a way to contribute, please let us know. This is not our effort that we're bringing to you. This is our effort, the big hour here. So So that is all. And Nicole, did you have any follow-up on next dates or anything like that that you think we should know before we close out today?
Yeah, our next meeting will be October 27th, and that will focus on goal 3, which I believe is assessment, diagnosis, and of course I'm going to forget evaluation. And I also have a poll for the meeting eval. So please, I will launch that right now.
Okay, go ahead and launch that. And as you guys respond to that, thank you for responding to it. We all know we need to get feedback on our efforts and report out on efforts often. Some of you might not know already, but you'll be learning soon, if you haven't already, that we are in this new format reaching out to you to help design the next Dr. Early State Team meeting. So it's different people for each one. But some of you will be hearing from us about future meetings and sort of planning that content. So thank you for that. I really appreciate very much. I want to say thank you on everyone's behalf to Barb and Cassandra for reporting out on Help Me Grow, both at the national level and at the state. And thank you to every one of us for the great discussion in smaller groups. I look forward to reading about what happened in the other group. And we'll work together on ways to follow up on that and make sure that we're taking action on the ideas that are workable from what came out today. Thank you, everybody. Have a good afternoon.